got my laces tied. My trusty podcast by my side. If you wanna talk fun, it's the place to be. Yeah, it's the drop, D-R-O-P.
All right, because I'm always horrible with names, and this one I know, Dr. Desmond Wilson, but I'm going to let Megan introduce.
Yeah, so today we are chatting with Dr. Desmond Wilson from Eternal, which we're going to learn all about today, but welcome to the show.
Hi, thank you so much for having me. I'm excited to be here.
I want to tell you right off the bat, because this episode is going to be about aging and that kind of stuff, and the reason I'm bad with names has nothing to do with my age. I've always had this problem.
It's all good. I have the same affliction. Historically, pretty bad with names. So
I've tried all the tricks. They're like, associate their name with something. I'm like, Desmond Tutu.
Yeah.
That's all I got, and then maybe Des Linden.
That's good. Desmond Tutu is my namesake, so that's good.
Oh, really? It is?
Yeah.
Oh, that's pretty rad.
Yeah.
I'm named after an island.
Really? Oh.
Yeah, St. Thomas. I was a mistake. But that's a whole nother subject.
That's hilarious.
All right, so we've got some fun stuff to cover today, but first let's start off with, can you give us a little bit on your background, school, how you got into this field?
Yeah, so I am a medical doctor. I'm a physician. I specifically am trained in internal medicine. So internal medicine, the way I like to describe it is it's general medicine, but general adult medicine. So I don't see kids. And I would say kind of like my journey into medicine started when I was like a little kid and had a few different mentors that really kind of pushed the skis of combining science, humans, and taking care of said humans. And ultimately, play the tape forward, I went to school in New Orleans, a little school called Loyola in Tulane, and studied anthropology there. Anthropology is actually, I'd say, like the bedrock for why I then decided to go to medical school. Anthropology, as boring as it sounds, is the study of the human experience. And the human experience is an ever evolving, ever interesting entity. And so what I wanted to do as a kid, plus my anthropology, kind of pushed me into medical school. Ultimately decided to go into internal medicine because I couldn't make up my mind. I didn't know like what exactly I wanted to do. And as a generalist, you kind of get to, play in many different sandboxes. With internal medicine, I then became really interested in this space that we now call longevity, but it's just about optimizing existence. It's about optimizing your life so that, yes, maybe we can add a little bit of time at the end, but more importantly, how do we live a fruitful existence where you are doing what you want to do, as an adult, as an older adult, potentially. It's to get me to that point, there were, many different clinics I was involved in, people I met along the way who influenced decisions to kind of head towards longevity and ultimately performance, because I would say that's twofold, just my own personal interest in performance as a runner, and then because of the engine that is performance that lends itself to living a healthful life. Or more healthful than you would be if you didn't have performance as kind of a bedrock. So it's kind of a long way to answer your question.
Yeah, I get that. When I think of it, though, you said something that is important to me because I had a father that had dementia and Alzheimer kind of cocktail.
Yeah,
and living longer isn't really like that's not the most important thing to me. Being around isn't that important. Enjoying life and being active. Like
Yes.
I was thinking about like I forget what I was watching one of these like movies with knights or samurais or something. And, you know, the guy gets his head chopped off, and I'm like, oh, that was a good death. You know, he didn't have to sit around or anything and, you know,
Yeah.
suffer or be in a you know, prison camp or anything. I'm like, I would go that way. But
Yeah.
it is, I think that's a shift. Like in science is the quality of life over the length of it. But I guess you're trying to figure out how you match those two together.
Yeah, I mean, what is what you actually described as a the beheading of the samurai or whoever it was. What you've described is actually this concept of health span and lifespan intersecting perfectly, and so health span are years without disease or really just disease or disability. And then lifespan is just a finite, the amount of time that you are alive, right? So you can imagine there's a gap there. And in fact, on average, there's about a 9-year gap in the United States.
9 years
Meaning
are going to
that-
suck.
Yeah, right? Yeah.
Oh,
Those are, well, no. Doesn't mean it has to be like that. Doesn't mean it has to be like that.
Okay.
That's what I'm focused on. It's about closing that gap. And so, yes, that's why, you know, I say, yeah, sure, let's try to maybe add a few years. That's great. But more importantly, how are we going to live with vitality until we get to, you know, hopefully the very end? And, you know, theoretic or I guess metaphorically, somebody beheads you. Hopefully
yeah.
it doesn't actually happen. So that's kind of where my interests lie, and my interest with Eternal, which is you know, who I'm our chief medical officer. Our goal is to focus on something we call athletispan, which is the same concept of health span, but what we want to do is we want people to be able to perform at a high level physically, mentally, metabolically for as long as possible. And we want to be your guide on that journey through both health, so healthcare, but also through very precise, thoughtful, guided performance advice as well, and interventions, I should say. So
are you guys working with like professional athletes or the everyday athlete or a mix of it all?
It's definitely ex-pros. We have quite a few ex-professional athletes. So folks who have, you know, stood on podiums in the Grand Tours, folks who have won Olympic gold medals, so on and so forth. Primarily, though, our like elite performers are no longer professionals, but were at some point, and we're 100% working with people who are more quote like recreational athletes. So you know, it's not necessarily their job, or they don't get paid for it or anything like that, but perhaps they were at their, you know, former collegiate athlete, or they are competitive, you know, in races, so on and so forth. Or none of the above, but it is an identifier for them. Like myself, I consider myself kind of in that bucket. Like it's a, you know, I consider myself to be intrinsically motivated. I consider myself to be an athlete in that sense. And so we're here for all of the above. And it's really cool, I think, because for the folks who have had that kind of multidisciplinary high performance team, whether professionally or in the collegiate space, and they know what that feels like, and they know how effective that can be in their performance. Once they're out of that space, that kind of dissipates, it disappears. And so we provide that for them. And then for the folks who've never experienced that before, to be able to have a physician, a sports dietitian, a coach, have a, you know, we have other forms of, we call them subject matter experts, who also weigh in on a member's experience, is just something that is wholly unique and really kind of, I think, riveting. It doesn't exist. Nobody else is really kind of doing this.
Why don't we talk about what some of those features are with Eternal? We haven't really described what Eternal is and how you plug into it and what it offers the consumer.
Yeah, so we are a hybrid platform. By hybrid meaning that we are partially in person, but we're also virtual. And what we provide is high performance healthcare. The model, essentially, the way it functions is you have a care team, which is your coach and your doctor. The coach and doctor meet the member virtually. We then have our member undergo something we call our assessment. The assessment is the portion that is in person. You go to one of our assessment centers. We have two. We're launching in 2 markets. We've launched in 2 markets in San Francisco and New York City. At the assessment center, we take you through multiple tests that are focused on strength and power, mobility, as well as aerobic capacity. So, for example, we'll have someone undergo a VO2 max test or a submaximal test if for whatever reason we can't do the VO2 max test. We also will assess lactate threshold. We also have a member go through something called a DEXA machine. So a DEXA machine is a way in which we can assess body composition. So looking at, for example, subcutaneous fat, lean muscle, bone density, all things that are extremely pertinent to health in general, but especially when it comes to performance. And I would say that for everything, not just the DEXA machine, but for all of our other testing as well. Also in the mix there is a member will have lab work done. So we check multiple biomarkers from both blood and urine. So once we get all of that information, we meet, the care team, we meet and essentially synthesize that information in the context of the person. So what their goals are, what stage in life they are in. Are you a 31-year-old, postpartum mom who loves cycling? Are you a 68-year-old, male runner? Maybe you have chronic injuries. You have concerns around your heart health. Those are all taken in the context of these really kind of unique markers that we have for the member. And the team we meet. So the coach and the doctor, we discuss, we'll talk about Thomas and say, this is who Thomas is. Let's take into consideration everything we see here. And then we're going to come up with some priorities for Thomas. Then in concert with you, with your input, we land on some goals. Those goals are then very strategically laid out in front of you. And we talk about how can we create habits around this? How can we operationalize these goals so that we can really have an impact? And I would say philosophically, we really believe in the power of small bets, big wins. So creating habits on a more like atomic level, and then over time creating really impactful change, whether that's related to performance or health or all of the above.
So if someone's working with a coach that they like, can they plug them into the system, or do they need to be using an internal coach to be? So
we work with, so our coaches are more like a guide than like a day-to-day like running coach, for example. Okay. That said, we 100% will work with, if you already have a coach that you love, we will 100% work with them.
Plug them
in terms of just recommendations around training, so on and so forth.
So, I've always had a question because, you start to, as you get older as a runner and stuff, you think, I think when you're isolated or like I always run with younger guys and stuff. And I'm like, wow, I'm getting older. And then I'll go to a race and there's tons of dudes who are, you know, way older than I am who are throwing down. I'm always like, were they really, really fast at one point? And now this is their slow. They're slow. That they're so fast. I don't know.
Yeah. What's the question? You mean like
I'm guessing like you guys are, since you're studying aging athletes and aging performance, you would know like you guys have looked at this phenomenon and looked at the athletes that are out there and studied how can we get the most out of these athletes. And I guess my question was, were these guys at one point super fast and now this is their slower time, but still pretty fast?
Yeah. So, right. Like, so, I mean, as we age, you certainly can see changes in performance. That's, you know, kind of a natural progression. It's how kind of precipitous is that change, or I don't want to say decline, because it honestly depends on what you want out of your performance anyway. So your PR might not be what you're after. So I don't want to necessarily say decline. But there's potentially smarter ways to, you know, accomplish whatever that goal might be so that you are not necessarily crashing or, you know, not showing up the way you want to show up. And so
I think,
yeah.
I was going to ask, are you finding any like myth busting stuff, like things that we've thought of as just given, like when they say, okay, this is the age that stuff starts dropping off, or this, have you guys been finding data to like, you know, get rid of some preconceived thoughts?
Yeah. I mean, one thing that that people think it's kind of like an adage is that older athletes should just slow down and should just stop. Like, you know, should stop running, stop cycling, whatever it might be. And that's just not true. You can definitely continue to perform at high levels with the right systems in place. I think that with aging, the important thing is you don't need to train less, you just train differently. And that can feed forward to, you know, performance goals that you have set for yourself.
Yeah, so one thing that I've noticed specifically in the running world, like we're very in tune with marathoning. That's sort of like where we specialize. And specifically with women, I will say, I feel like we used to say mid-30s was when peak performance happened in the long distance running. And now we see women who are in their early 40s who are breaking records and still performing at a very high level. And I'm just wondering if through your studies you've noticed like is this just we're more educated on the importance of nutrition or strength, or what do you attribute to this sort of extension of performance?
Yeah, so let me just first off say, so with Eternal, we haven't necessarily like collated our own numbers yet. We just launched. Okay. We don't have enough data to say specifically like what's happening with our members, although that's certainly a goal of ours. But in general, adaptations around, again, kind of training differently, especially for, I would say, female athletes, has changed quite a bit, especially around like resistance training, especially around mobility, and focusing on those entities, and 100% around nutrition as well. And I think that because of those adaptations, within the training sphere, you're seeing people kind of do things that, like, as you noted, right, that previously was just relegated to, second, third decade of life. And that's just not the case. I myself, so I'm a trail runner. So you certainly see that in like the trail world a lot. A lot of the female and male, folks who are out there, winning Western States, Leadville, whatever it might be, they're a little bit older than they used to be. Yeah. And a lot of that, again, has to do with training adaptations, and having, honestly, a lot of these folks, I think, have very good teams that know them physiologically, and also just have good, sound science to back up interventions that they've deployed for their athletes. And we are trying to mimic something very similar, but for everybody, not just for, the I don't know, Courtney Dauwalters of the world or people like that. But there's certainly having informed expertise kind of back up what you want to accomplish goes a long way. And I think that's why you see longevity, and not just in endurance sports, but a lot of different sports. Look at basketball, look at LeBron James. He's 40 years old, right? And he's still performing at a high level. And a lot of that is 100% goes into how is he recovering? What's he doing about sleep? What's he doing about nutrition? What's he doing about resistance training? And like really looking at it with a fine-tooth comb. And that used to not be the case.
All right. Well, that leads to a couple questions. I know Eternal is a program that people would sign up for and do, get intense, advice and helping. But are there little nuggets for the audience that just things that people you find are overlooking that make a big difference in performance while you age? Some things that, like, tips that you could just give an everyday guy or girl.
Yeah, for sure. I think that especially as we get older, there's two things that I think are super important, which are around recovery and I think around more periodization. When we kind of go back to the, kind of like these adages or things that are, we think are truths but aren't necessarily truths. Another one I think of, which is kind of on the opposite end of the spectrum of, older athletes should just slow down, is, it's like if you keep training hard, you'll stay young. And that's not necessarily the case. Meaning if you continue to just have the gas pedal on full tilt, that there won't be any repercussions. And that's just not true. So I think that for kind of the, not even just like your average recreational runners, but, if you do talk to like pros or ex-pros, like periodization and having moments of having moments of decreasing your level of activity to 50% of what you might be doing during a regular training week, once a month, or rather I should say once every 3 to 4 months, is not a bad idea. Like that's going to go such a long way in the realms of when we talk about durability, when we talk about energy expenditure, not matching energy intake, and then a few other areas as well.
So would that be like after you run a marathon?
Yeah,
taking that week or 2 weeks off, or are you talking about continuing during your training and
like during your training, like it's individualistic, right? It depends on what you're training for. It depends on what your baseline is, but generally having times where it is fixed within your programming where you are not training at what would be maybe, your 80 to 90%, goes a long way, not just for like the immediate, like the feed forward to how your performance is going to be, but then when we think like long-term, for example, with a lot of endurance athletes, we mostly see this in men, not women, but especially cyclists, I should say. So one of the risks potentially is something like an arrhythmia, so like a cardiac arrhythmia. So, probably the most classic one is atrial fibrillation, which you may have heard of before. But there is a signal in the data that you do have this increased risk of developing something like atrial fibrillation after years and years of kind of nonstop, non-periodized training. So that's another reason, like when we look at the long view, like whenever I think of like our members and the way we think as a company about our members is, yes, we can go back to even just talking about that, small bets, big wins. Like, yes, we're going to focus on, let's say you're training for a marathon in 2 months, and we can 100% talk to you about hydration, integrating, resistance training, whatever it might be. But also I'm thinking about you in 5 to 10, 20 years, from a durability perspective, but also just like an overall health perspective, right? I'm thinking about your heart as well. I'm thinking about, we're talking about recovery, for example, right? And when we talk about recovery, really that's the bedrock of that is sleep. Yes, you need to have good sleep so that you perform better the next day, whether you're training for something or not, but also you need to have good sleep because play type forward, we know, and you mentioned your father, Thomas, that, one of the risk factors for neurocognitive disease, which Alzheimer's is one of those, or dementia, is poor sleep, years of poor sleep. And so in this kind of population, thinking about that as a risk factor is super, super important because you're really kind of, killing two birds with one stone. So like more of the immediate outcomes and then potential long-term benefits as well.
So maybe don't take the David Goggins approach and always staying hard.
Yeah, maybe not.
Okay.
Speaking of recovery, what are your thoughts on all of these like recovery tools out there, like the Theraguns and the ice baths and there's like a recovery solution for everything. But obviously we know that sleep is really the best tool, but in general, do you think that those are beneficial?
Well, it kind of depends on what we're talking about in terms of recovery. Like if we're talking about like injury prevention, if we're talking about, fatigue prevention, it kind of depends. It's a pretty big bucket. Those two things in particular, like ice baths. Ice baths do have some immediate benefit. They might be slightly different for men versus women, depending on how cold your ice bath is. But you can see some benefit related to like muscle recovery, as well as just for mental stimulation as well. So that's important. For Theraguns, 100%. For folks who are potentially, who have an injury or, kind of along those lines. But in general, there's hundreds of, supplements, elixirs, what have you, that are kind of advertised, and that might be recommended by like influencers, so on and so forth. And
are you talking about ketone IQ?
Yes, yeah, exactly. So you just have to be, vigilant. And I'll tell you, for us, like like on our team, this is something that we think about frequently, because folks have what's at your disposal in terms of what is out there is just so vast now, because of social media and podcasts and like this amazing podcast we're on right now. And so we really like to do a very good job on vetting what comes through the door, because people have questions about these things, and people want to, if not optimize, they at least want to know, like, are they doing the best that they can for their health? And so sorry. So it's kind of a long answer, but it depends.
The thing that catches me off guard, it sounds like you guys are using science and the best knowledge that we have currently, which I think is always the case. You look back and we laugh at some of the things that people thought in the 60s or 70s and moving on with the health and sciences and stuff, and even the demonization of like salt. And now, I'm taking extra salt when I go on my runs, and it's helping. But when we look at something like these supplements that come out, and they basically, it's almost like I feel like we go back to the 1800s or something, where they had medicine shows, and they're like, hey, whatever ails you, this will cure it, and just buy this bottle and you'll be fine. And the fact that humans haven't adapted and like seen that before and been like, oh, wait a second, this might be garbage if they're promising everything.
Yeah.
I don't understand how we still get suckered, but
Yeah, I think I think it's multifaceted. I think some of it is like a changing trust, honestly, I feel safe and confident saying this as a healthcare practitioner. I feel like there's been definitely a shift in the trust that people have with their doctors and other, clinicians. And also, like, health is just, for some people, it's just not very sexy. Like, it's not very cool. And then when you have an influencer who is talking about something that is very sexy and very cool, that maybe will allow you to, I don't know, you'll, cut 15% off of your PR or whatever it might be, you're going to go after that. Or let's say that thing, improves your sleep by 50%, whatever it might be. And so when you see that kind of in the realm of like social media, it hits different than if it kind of comes from your boring doctor in their white coat, even though your boring doctor in your white coat is looking out for you and hopefully has kicked the tires and understands what's necessary for you. I think that's what's the most important thing. Like, it's pretty classic that the doctor says it depends, but it's true, right? Like, what I like to practice and what I would say practice at Eternal is like personalized care. It is precision medicine, meaning that the inputs are you and the outputs are based on you. So the inputs are not what's happening to everybody else or everybody else's experience or everybody else's objective data. It's specific to you. Thus, what we're going to recommend is going to be that as well. And so
Is
the
that
problem with what's out there, what's on social media, so on and so forth, is it's like people apply that. They think that knowledge applies to them, right? Like I don't, if I'm listening to a podcast or something like that, like I don't actually care about what so-and-so takes who's doing the podcast because it doesn't apply to me. Like what they're
right?
doing, their protocol does not apply to me. And so, what's great about what we do, and I would hope that, any, kind of entity in this healthcare sphere that's worth their salt, what they do is they take this kind of precise, personalized approach because that's how you're going to get the most benefit.
Yeah, I can see that. Like right now, Ozempic seems to be the rage, and even like Kardashians having Ozempic, or what's it called, GLP-1?
Yep.
GLP-1 agonists,
yeah, that you can buy basically, through them. And again, as a doctor, are you seeing this and being like, this is a good drug for somebody who needs to get down below diabetes and et cetera? But now that it's kind of like being like, do you think it's being abused by the general public?
So let me answer the first question. Do I see like its use and do I see its utility? 100%. So GLP-1s aren't necessarily new. They've been around for a while, but the kind of the newer generation of like semaglutide, which is what is Ozempic, and then tirzepatide is the other big one, which is Wegovy. They 100% work for certain people, like people who have problems with their metabolism and sugar regulation. So yes, diabetics, but even folks who are kind of on that spectrum. But there's also great evidence that's supporting FDA approval around sleep apnea, around heart disease, around addiction, because of the mechanisms in which these medications work. And so for those people, yeah, if we have something that works, that's what I want for my patients, right? Like obviously you need to weigh the risks and benefits for every single person that walks through that door. You need to have discussions about risks and benefits. You need to have discussions about other things that have been tried. I think that's extremely important. So yeah, I would 100% use a GLP-1 if it's appropriate. your second question is it being abused? And 100%, because of, again, kind of this like social media influencer kind of
I mean, Oprah
world.
went on and talked about
Yeah.
it.
Yeah, but then again, that's her. Like, perhaps Oprah has diabetes. Nobody knows. Like, you know what I mean? Like,
Yeah.
Right.
there's just so much. There's what one person does should not influence what, or it shouldn't be what you do, right? Like,
Mhm.
you guys talk about. I love the depth you go in on shoes, right? And like when you are talking about the midsole of a specific model of a shoe, you're not saying everybody needs to wear this specific shoe, right? You're saying maybe if you are, doing a middle distance run and you have an issue with your arch, whatever it might be, like this would work really great for you. And we were comparing it to X, Y, and Z. And so like I think of like medications and GLP-1s the same way, where it's like, yes, it could potentially work for you, but like you need to talk to somebody specifically about this. You need to go try, or maybe not try the shoe on, but you at least need to maybe go get fitted and, speak with somebody about it. So it's kind of the same way. And so like this like level of like, I'll air quote abuse, it's not, it's just people are ill-informed. And I would hope that you're not really taking any medication without like a very real conversation with
Physician.
not just healthcare provider, but hopefully somebody, somebody who
Okay.
knows your health history really well.
So,
Yeah, but
so
it's
curious,
it's
like,
unfortunate. It's unfortunate. It's because it's like these are good drugs, but they have like a
Yeah.
bad name. And I'll tell you, in the endurance sphere, they're really really interesting because depending on what kind of race you're in, they're they're banned, right? When we talk about like weight,
are they a performance enhancer?
well, when we talk about like weight to power
Ah,
sports, talk about
okay.
cycling.
So like cycling.
Yeah, yeah. So you'd need like an exception if you were to be on one. But anyways,
So,
yeah.
so
So it's
that brings up a good question because as aging, I'm sure there's athletes that are tempted to, try some things that are banned, like testosterone or other EPOs or something like that.
Mm-hmm.
How familiar are you guys with that and understanding how that physically impacts people?
Just how familiar are we with like hormone replacement therapy in general, or specifically like what like is like on the USADA banned list and how that
No,
might?
I'm not asking if you know what's on his how to ban list. I'm saying
Yeah.
when you're working with athletes, and obviously people are coming to you, and I know that Eternal is new,
Yeah.
but if say somebody was deficient in, say you have an aging athlete that's deficient in testosterone or something like that,
Yeah.
are those the things that you guys recommend, or like do you guys keep it pretty much to carrots and carbs?
That's great. That's a good question. So it's kind of like about our scope of care. So first off, this actually brings up a really good point, which is again when we talk about lack of periodization and we talk about like overtraining, one thing you will certainly see in male athletes is a low testosterone. So depending on what your kind of level of training, that's one thing that in this population we think about immediately, right? Before we immediately jump to would be considered like a primary cause. Like there's a problem with, where you produce your testosterone, your testes. So that's taken into consideration with this group. But in general, so yes, we can and will prescribe for the appropriate person. Again, evidence influenced decision making, like our protocols are based around that. But there is a very strong discussion around what level of competition that member has. Because again, honestly, I was asking if you meant like the USADA banned list, because if testosterone is going to be banned. So like depending
Yeah.
on what you want to perform in, And you can there's an exception protocol for that, for any of those sanctioned events. But if you want to perform at a certain level, understanding that this is a banned substance, and that's actually a completely different kind of discussion. If you are somebody who we've done the due diligence and you truly have we call it primary hypogonadism. So you're not producing, I'm just using testosterone as an example. And understanding that, you're not performing at that level, maybe you're just like a weekend warrior, whatever it might be, but you do need true hormone replacement therapy, then 100% we can support people there. And then we're talking about our male patients, but our female patients as well. We 100% have the capacity to support hormonal transitions, specifically around like perimenopause and menopause, not just with medications, but lifestyle levers that can be pulled related to nutrition, related to mental health support, related to supplements, whatever it might be. And yes, we can also prescribe medications if it's appropriate. And that's kind of my point, is personalization is what we're after. And I think what is the reason I'm here is like it's lacking in the greater ecosystem of healthcare, especially in this country, in the United States.
I see that as kind of, we have shoes that have stacks over 40 millimeter that we call illegal shoes for you can't podium in them.
Yeah.
But if you want a good run and have nice cushioning and you're not looking to podium, that you can certainly wear them in any race, except for in the Ironman series. They seem to disqualify people for wearing random different shoes. But but it sounds similar. Like, okay, the health of the athlete is the number one priority, and then following that is their goals for, okay, if you are competing at the highest level and you're trying to podium or something, maybe we're going to find another way, like a more holistic way to raise these hormones in you, like weightlifting or something like that.
Well, more holistic, but more specifically, like, why is their testosterone low, right? Like, is it related to their training, which ultimately is affecting their performance? So like, that is like the lens that we have, that person, which is another reason why we exist. Like that person, if they go to their doctor, like their, garden variety, internal medicine doctor, which, I consider myself, I'm in that fraternity or was, that's not taken into consideration. Like that athletic lens is not taken into consideration. And that person might just be placed on hormone replacement therapy with zero questions around their, you find out that they're training 20 hours a week and, they take in maybe, 1,500 calories per day or something, whatever. But my point is that these things are like missed in the kind of the quote, like the real world, or at least by like normal, like your normal practitioner. And that's no fault of the system, if you will. It's just that it's a need I
was going to say, we do a podcast called Fuel for the Soul, and we specifically say this is nutrition for people who are athletes. This isn't nutrition for somebody who's not burning the calories to eat up the carbs that we're recommending, or, this is for performance and the best performance. And I know that I've gone to doctors and then I've stopped going to doctors. As a matter of fact, I'm probably the worst because I see a doctor maybe once every 10 years. And it's basically come down to their answer. If you have an injury or something with running, stop running. Or if you have your foot hurts and you go to a podiatrist, they're like, stop running. If you go, to the doctor, you're just like, no. So I think there's a big need for it, for medical assistance for people who want to be active throughout life. But I also think almost shouldn't all doctors start to be
performance driven,
because everybody should be like, if I had a patient that's not active, I should be trying to get them active.
100%. Yeah. Yes. We talk about this concept of training age, right? So a lot of endurance athletes, what they don't necessarily do and should, and many are, right? Going back to talking about these folks who are really, changing the paradigm in terms of age. But a lot of people don't lift, right? They don't do any kind of strength training. And so they have a training age of 0. And although that person has like an athlete's mentality, you're still starting from scratch, right? So you still need to like bring them up to speed in creating those habits. And you can ascribe that to, John Doe, who's sitting on the couch, who has a true training age of 0, like they just do not exercise at all, and still apply like these exact same principles, especially if they're like motivated around their health. So yes, to kind of reflect back what you're saying, like, yeah, I mean, it is a concept that should 100% be applied to everybody. Like it's, you go to your doctor now and they tell you need to be exercising 150 minutes per week. That is the end of the conversation, right? Are you doing it? Yes or no? Yes. Okay. Moving on. Let's talk about,
How many drinks do you have a week?
Yeah, exactly. Yeah. Right. Let's talk about, okay, you have the sniffles, whatever it might be, your allergies, all the other things, which is, to be fair, as someone who used to like live in that world where you had 10-minute appointments, and it's hard. I mean, it is really, really hard. Yeah. But the emphasis on not just the time, but like what people are doing, how they're doing it, is it appropriate for, their demographic, like who they are, do they enjoy doing it? Like all of those things are so important, because the beauty of performance, other than obviously like the potential like physiological benefits, is like there's so many other things. Oh my God, like the mental, emotional well-being, the community building, like all of these are part of it as well. And it's just, there's just, I don't know, there's nothing like it. I mean, I live in Northern California. So like when it's just me, like in the woods with me in the redwoods, I'm basically like at church. I was like, this is perfect. Like it will level set my like day and or week. And that's so powerful. Right. And so, yeah. Anyways, long way to answer. Yeah, I agree. Well, every doctor should be.
Okay. By the way, I'm from the Northern California originally myself, but the other thing I was going to say is what I've been relying on instead of a doctor has been I get blood tests through.
Yeah, I was going to mention this. So I feel like what Thomas and I have been doing is trying to piecemeal sort of what you have built with Eternal, where we get our blood tested every quarter. We have a sports dietitian that we work with. We have a running coach. But I think the piece that's missing, and what you sort of mentioned, is how you all discuss every aspect and sort of create this holistic picture for a very individual person. And like that seems like the most powerful thing, because even if you are seeing your doctor regularly and you do have a sports dietitian, they're not talking to each other necessarily. So you're getting information from this person,
and you decide what you're going to listen to.
And then you interpret it how you want to. Whereas that idea of having the professionals talk and then present that to you, that feels like really special and impactful.
Yeah. So, yeah, 100%. I mean, so that we call that our roundtable, like the point where we're synthesizing you and we're, synthesizing priorities for you, and call it a roundtable because it's this idea of we're all talking, and then then we're collaborating with you too. Like that's also, I'd say, something that you don't see regularly. Like your medicine can be very paternalistic. It can be very like, take this pill, see you later, right? There's no conversation about, do you want to take the pill? Like, can you actually incorporate that into your life? Like, so on and so forth. But at another point to what you're saying is, a lot of folks have to be like communicators for themselves, and it's like, wait, you're not a doctor, you're not a dietitian, you are you, right? Like whatever whatever your profession is, and like it's not your job to do that communication, and it shouldn't feel like that. Like it shouldn't feel like work to ingest your data and then have to talk to every important member of your team, and they're not even talking, because then you're just kind of like, you're not necessarily back to square one, but it's almost like I this concept I often think of, it's the lost in the woods concept. And it's like, you go to REI, you like get the sleeping bag, you get the flint, you get the compass, you get the headlamp, you get all the things, you bring all your food, you bring your stove, and you have no idea what you're doing. You're just standing there in the middle of the woods. You got all the goods, but you have no idea what to do. You don't know how to build a tent. You don't know how to start the stove. You think you know. Somebody told you, like, I don't know. You know what I mean? So it's just like, and
You
like,
sleep in your Subaru.
sleep in your Subaru. Yeah. Like, nobody wants to feel like that. Like, people don't want to feel like overwhelmed by their own data. Like, that feels just so backwards, right?
I'm going to add one more step to Eternal. I just want to live there for 6 months. That way I don't have to do all the work on my own. You know,
Have like a chef and
I'll just drop me there. I'll just do whatever you guys say.
Yeah, that's the platinum tier. You can get in. We'll talk about the price offline, but yeah.
All right. Is that the Steve Jobs price?
Yeah, exactly. Yes.
Right.
It'll cost you one private jet.
All right. G4 or G6. That's what he wanted.
Yeah.
All right. So I'm actually signed up to try this. And
Amazing.
so, so I've got to fill out the stuff.
You're New York, right? Because you guys are in Baltimore.
Yeah, we're in Baltimore, so New York would be the easiest.
Yeah, we'll probably go up to New York. It's just a matter of time. I just got back from travel, and we're going to Boston, and then we're going to London. So I'll probably sign up after that, kind of start fresh, because I'm finishing up a training cycle now. But I'm interested to see how it works. I'm relieved to find out that, like, I've been working with a coach, and I enjoy working with him, so that I can plug him in and bring him into the program. Makes me feel good that I don't have to give him a call and be like, hey, later.
Our coaches can talk to your coach 100%.
Perfect. And then I guess we'll give some feedback on how it goes. And does this plug into my Strava since it's part of like the Strava universe?
In the works. In the works. Not just yet, but it's in the works. Yeah.
Very good.
Because if it's not on Strava, it didn't happen.
Right. Exactly. I believe you guys are like, it's a wait list at this point if someone wants to become a member. Is that correct?
We do have a wait list. Our wait list is actually outweighs our capacity right now.
Okay.
I jumped to the top.
Well, you're doing the private jet tier, so yeah, you're right.
Yeah.
If you just go to eternal.co, you can join our wait list there.
Okay. Awesome. Is there anything else you want to leave our listeners with?
You know, I was going to say no, but I think just the most important thing is, yes, with Eternal, but in general, athletes should not have to feel like they are unheard. I feel like I've talked to a lot of members at this point, and the reason that this, a large reason why this company was started is because there is there's this schism between the concept of an athlete having health problems, or not health problems, but caring about their health in the context of what they love to do. And so I would hope that we can provide some solace by being that place to go to.
Yeah. Nothing makes me more excited when I'm at a race or even doing my easy miles around, town, when I see somebody who's clearly older than me, or I think everybody, but when I see them, and I'm like, that's what I want. Like, I think that there's an inspiration of these people that come out and they are 70, 80 years old, and they're still having fun and enjoying being part of a sport. And
you don't lose that identity, right? It will be there forever. And that's athletic right? Like, that's what it's doing, what you love for as long as we can do it for you.
That's the thing. And you look at, I when you talk to somebody who's older and they're like, I stopped running, and we'll interview people that used to be runners, and I don't do it anymore. And whether it's because they slowed down a little bit and they don't feel as validated by their times anymore, or they don't, whatever it is, it's, to me, that's heartbreaking. And I'm like, oh, are you leaving money on the table? Are you leaving like quality of life because you just feel like is it a mental thing? And so the idea of being able to kind of test it and find out where you are and have like a realistic like place of starting from to understand what you're capable of. Like maybe you're not going to be winning in podium races, but maybe you're going to be able to continue to get out there and find a way to be part of the community and feel a part of what's going on in a sport you love. So that's the exciting thing for me is what you guys are doing is keeping people active longer and in the mix.
Yeah, for sure. I appreciate that. Yeah, definitely. And I'm glad you're going to, I guess, will this be your first doctor's appointment in 10 years?
Yeah, if I show up.
Well, you're going to have to show up because you're going to live at our assessment center. So.
Yeah.
Right.
I mean, last time I went to the doctor, it was because I cracked my head on a marble countertop and they had to staple my head back together. But I was like, just check the vitals. And, as a matter of fact, it was crazy. They wanted to hold me longer, and we're like, why am I still here? And they're like, your heart rate is really low. And I'm like, what is it? And they're like, it's 40. I'm like, that's my resting heart rate. You can let me go.
Yeah.
Well, yeah.
That's funny. Well, we're looking forward to having you.
All right. Well, yeah, thank you so much for chatting with us today. This was fun, and I think this is a really awesome and valuable space and I think our listeners are going to just love this. So,
Meg, how do people find out about Eternal if they want more information?
he said go to eternal.co.
Okay, cool.
Yeah.
You got it.
Easy enough.
Easy enough. Yeah. Thank you, guys.
Give a good stretch, got my laces tied. My trusty podcast by my side. If you wanna talk fun, it's the place to be. Yeah, it's the drop, D-R-O-P.